I'm Allie. I came out after 20 years of marriage and I have 3 kids.
I'm Melissa and I have 2 kids and I came out at 37 after an 11-year marriage.
This podcast is about coming out later and the struggles and victories that come with it.
When coming out feels like the end of the world, but it's really just the beginning.
This is the Lesbian Chronicles. Welcome to the Lesbian Chronicles.
Hello, my friends.
I gave you a little chance to beat me to it, and you didn't do it.
Oh, well, I mean, I like to leave the ball in your court. I just wanted to do it that one time since we were in person.
Okay,
So.
I like it. I am hearing a slight echo, so I want to apologize to anybody listening.
Yeah.
We've got a weird setup today. I know we always talk about our setup being incredibly tenuous every week, but today's was really gymnastics.
Yeah, it's hard living and just making computers work.
It's true, especially in 3 different locations.
Yes. I know I like to praise myself as being like pretty tech savvy, but then when it comes down to it, sometimes I'm just like, I can't compute. I don't know what to do.
What's crazy is like when we first started doing this a couple of years ago, you were tech, like I feel like she knew everything. Like I could ask you anything and you'd be like, just plug it into the cactus, do this. But it's like as it's gotten more advanced, like clearly.
Yeah,
now
sometimes
it's like
if we're doing
wheelhouse.
Zoom and the board and
Yeah.
the guest and headphones and yeah,
it gets a
a
little
lot.
complicated. But the big thing
So-
that I want to talk about is we have a wonderful guest here. And before we dig in too deep with her, we just want to remind everyone about our new website. And so it's lesbianchroniclespodcast.com. Go there, sign up. People are already signing up in different states and areas. It's really kick-ass.
Yes. Yeah, we've had a really solid response already. I'm surprised by it. Not surprised, but
Just how many people are willing to put themselves out there and put their story on the site, to me is compelling and insane. So,
and if you're having any problems with it, shoot us a message. We'll work on figuring it out. It's like it's in the very early stages. So, give us some time to get the kinks worked out. But I'm very excited about it, especially like being able to have merch and be able to have people connect and really, really come together and find the people that they need to talk to.
I agree wholeheartedly. Well, let's not waste any more time because we have Dr. Kara Strauss with us today.
Yeah.
Master of physical therapy with a strong, I guess, your practice is really focused on the pelvic floor muscles, which I find kind of fascinating. So a little backstory. I met Kara at a party and I'm a physical therapist by trade, so I'm always interested when I meet physical therapists. But then you were just so interesting to talk to, so I thought it'd be cool if you came on the show. So welcome.
Oh, thank you.
Yeah. So talk to us, I guess. First of all, give us a little bit about your background, and then we'll fire away.
Well, I actually have a background in exterior design. Not true.
That's amazing.
Exactly. Wow. Okay, this is interesting. Yeah.
But I did start my career in marketing and business, which was just a complete mismatch. I got fired often, finally made the switch 15 years ago. Went back to school to become a physical therapist. And so as a physical therapist, I went to Georgia State University, which now I am their newest member of the physical therapy faculty.
Oh,
at
that's
Georgia
exciting.
State. So that's been a lot of work.
Yeah.
We'll just leave it at that. But full circle. But I have been practicing for 12 years as a PT now, and I first started just in very orthopedic outpatient setting. As I was practicing, I kept realizing with patients, especially with low back pain or with hip pain, that there was almost always something missing from what I was doing. And long story short, that thing that was missing was the pelvic floor.
Yeah.
So that was why I decided to start pursuing more education around, what is the pelvic floor? What does it do? Why is it important? And then how can I help people with theirs?
Right.
So I guess I've been doing that 7 or 8 years now.
Which is kind of like a niche thing. Like I don't know that many I know a lot of physical therapists just because I was one, but you don't hear people who focus on that as much. So it's kind of it feels like a niche thing to me, but maybe I'm wrong. Maybe it's
It's definitely niche.
Yeah.
It's not as niche as it used to be.
Okay.
And Atlanta has a robust community of pelvic floor PTs. We're really, really lucky.
Yeah.
In any part of town, you can find a few pelvic floor PTs. And we're all very busy, though.
Yeah. Is your practice just that, or
It's
is it not? Okay,
no.
you see lots of different patients, but that's your focus.
I'd say I'm about 50% pelvic floor
Okay.
at this point.
Yeah.
And that's where I like to keep it, just because I'm a person who likes to do a variety of things.
Right.
And then my other personal specialty is working with aerialists.
Okay.
So, think Cirque du Soleil.
Yeah.
But I'm seeing more hobbyists than
Okay.
I am, although not to downplay the talents of my patients, because they're wonderful performers. But, they're not people who are getting paid to perform on a regular basis. So my clinic is right next door to an aerial studio that I also go to.
Oh my God.
So I see a lot of aerialists, and I see a few just neighborhood ortho folks who just have a random neck pain or a knee pain, and then the other 50% is pelvic floor.
Oh, okay. That's very cool. Aerialist. I never even
I was
thought
wondering
about
the
that.
connection between
Yeah.
the aerialist and the pelvic floor. I'm like, is there something that's going on in this profession that people are messing up their pelvic floor or something? Or is it just that it's your neighbor?
Outing all of the aerialists I know, there is sort of a common theme that people will pee their pants a little bit when they invert.
Okay.
I'm not going to say everybody does it all the time, but I certainly hear stories about, the little trickle coming out, or queefing while we're inverting.
We're diving right in.
I know. Wait, do they come in and say that just like that?
Some people are very open with it, and then some people lead with, this might be TMI, but
Yeah.
where,
You've heard it all.
there's just no TMI for me.
Okay.
And what are we going to talk about if we're talking about pelvic floor? You're going to tell me about your peeing, your pooping, your sex habits,
Right.
if anything's coming out that shouldn't be. We're going to talk about all the good stuff if it's working, and all the stuff that's really a problem when it's
I would
not.
struggle because I'm such a prude, I think.
Be like, can I write you a note, please?
Exactly. I'm going to email you and then tell me if I should never
Email
come in
you.
again. I think what got me thinking, though, when I met you is I remember this connection when I was doing physical therapy, that people would have these I guess two things. One is that people would have these emotional breakthroughs with their pelvic floor therapy when they did finally get pelvic floor therapy. But the other reason I thought you were compelling is because a lot of our listeners are, I know this can be women or men, but a lot of our listeners are women. And some of them are going through menopause or going through they've had babies, and now they are having these issues of whether it be prolapse or whether it be, like you said, they're a little bit of a trickle, maybe when they laugh or sneeze. And I think people don't talk about it. They wouldn't even know who to go to.
I can tell you also, as a CrossFit member, whenever we had a jump rope workout, anyone over the age of 30 who had a child was headed to the bathroom first.
Yep.
Every single time. There was no one in that place that did not was not worried that they were going to be peeing a little bit while doing a jump rope workout.
So is that who would come in to see, what would lead somebody into you?
Well, first of all, in the business, we call that a just in case pee.
Okay. A just in case pee.
Yeah.
I mean,
just in case.
I was
Okay,
hesitant.
yeah.
I was like, I'm going to not risk anything here.
Hell
Right.
no.
And it's one of those things that we say that is common, but it's not normal.
Okay.
Like
common meaning maybe after a certain age, half the people are going to have that issue.
Especially if your pelvic floor has birthed a human.
Yeah.
That is, and it doesn't matter if it's a vaginal delivery or not. It's still a lot for the pelvic floor to go through a pregnancy.
Right.
So yeah, but for the folks who are coming in, some folks it's really as simple as, I'm peeing my pants when I don't want to. Well, who wants to pee their pants?
No, hell yeah.
And I'm going to help them figure out how to time their pelvic floor contractions so that that's not happening anymore. And, sometimes it's as straightforward as we actually do just need to work on Kegels or pelvic floor contractions. That, you can try that on your own if you think that's all that's going on. You might not need me for that. But
how do you know what's going on? How do you diagnose?
I'm going to need to obviously do some testing as a PT, and you as a PT yourself know that we take a lot of objective measurements.
Right.
So for somebody coming in with a pelvic floor problem, I'm measuring their low back and their hip and their strength and their range of motion. But then we're going to do those same things with the pelvic floor muscles, which those muscles live inside the bowl of the pelvis.
Okay.
And I can feel if they are activating or not in a couple different ways.
Okay.
So if somebody came in for low back pain and I'm all of a sudden thinking it's a pelvic floor issue, I might not just spring an internal evaluation on them. Although sometimes folks are like, yeah, just please test me.
Yeah.
So an internal evaluation is very much what it sounds like. If the person in front of me has a vagina, then I'm probably going to use a digital vaginal exam and have them engage the muscles, have them relax the muscles, see if they can lengthen the muscles on cue, and then I'll palpate those muscles for tight spots.
Okay. Because I think
so
that is it. Sometimes it's not laxity. Sometimes it's like too tight.
100%.
Okay. So More often.
Yeah.
Okay, so it's not like they're weak down there. It's more like they've overdone. How would you overdo?
Is there such thing as too many Kegels? Is that what's happening?
Too many. What happens to get that happen?
I'm going to ask both of you, and I guess anybody who's listening right now, to just tune into your anus.
Oh boy!
Right now,
let me go right there to mine.
And then, are you?
Sarah, I did not sign up for this.
Yeah,
are you gripping? Squeezing. Are we all gripping our buttholes maybe a little bit?
Yep.
Okay. That's one of the ways that can get tense.
Okay.
So, if we're all walking around butt gripping.
Why would people butt grip walking around, like anxiety, nerves?
Yeah, I mean, if you think about shoulders and what we think of with a tense sort of structure to the shoulders, shoulders are elevated towards the ears and we're building up tension in these upper trap muscles. We also hold tension in the pelvic floor.
Yeah.
So that's one of the more straightforward ways that can come to pass, that somebody is holding too much tension in their pelvic floor, and then that can cause pain. And it can also
they're being a tight ass.
They're a tight ass.
Right?
Literally
a tight ass.
And the reason I refer people to their anal sphincter, actually there are two anal sphincters, but we won't get too deep into that.
No pun intended.
But yeah, that one, for some reason, we're all more attuned to that one. And also, everybody has an anal sphincter, so I know I can use that as reference for anybody who might be listening. But if you then are trying to feel that same tension vaginally or to the front part of the pelvic floor, if there's not a vagina, then it's a little bit harder to feel that sometimes.
Right.
Not everybody's as aware of those muscles. But the pelvic floor, whether we're talking posterior, meaning the anal sphincters, or anterior, meaning the vaginal, urogenital sphincters and muscles, all those muscles contract at the same time. So if you turn them on, they're all going to go on. If you relax, they're all going to go off. So you can just sort of use that anal sphincter as a nice gauge of what the rest of the pelvic floor might be doing.
I often wonder, so that's like, if you made me think about, like, when I do Kegels, I don't do them all the time, but sometimes if I'm driving, I'm like, okay, I'll bang out a little Kegel workout here. Can you not do it wrong? Like, sometimes, like, I hope I'm doing this right.
Oh, you can absolutely do them wrong.
You can, even though all the muscles engage, you can still do it wrong.
Well, and did they?
I don't know.
Right?
Yeah.
That's where the testing comes in.
Okay.
And I mentioned that there is a way to externally test those muscles, and I can talk you through it right now. Although maybe we'll do this in the privacy of our own homes later on, your choice. But if you take your hand and you place it sort of at the small of your back, fingers pointing down.
Okay.
And then I use my middle finger because it's my longest finger. If I do this with a patient, obviously my hand is gloved.
Yeah.
But I'm placing that hand against my skin, and the hand goes down until my middle finger is actually against the tailbone. So it's going like between the gluteal, the cheeks, right, to get to that bone.
Okay.
And we're not going in any holes, but we're right next to one.
Okay.
And we're also feeling the muscles of the pelvic floor. So the tailbone, also known as the coccyx, when the pelvic floor muscles engage, because some of those muscles attach to the coccyx, they pull it in.
Okay, so you can feel the bone pull in.
You can actually feel it like curl in a little bit, like if you saw a dog tucking its tail between its legs, like that's what your tail is doing. It's just tiny. So I can feel it, and I don't have to go in.
Okay.
And get too intrusive with somebody who's not ready for that for whatever reason.
But that's to test their anal or that?
That's going to tell me, are you engaging the pelvic floor or are you doing something else?
Got it.
Like if my finger gets pinched by the cheeks of the butt, then that's not a pelvic floor contraction, that's a glute squeeze. Or if the tailbone kind of pushes out, you're not engaging, you're bearing down. Right?
Okay, wow.
And then the other thing I'm going to look for is when I ask you to relax, does the tailbone return to that resting position? And that is just as important. So if you're banging out Kegels while you're driving, which I think is a perfectly fine practice, just make sure that you also relax.
Yeah,
when you're
yeah.
done, because that otherwise we're starting to build into that tension, and tension can make it hard to pass urine, hard to pass stool, hard to have comfortable sex, especially if you want penetration.
Right. But when you say like the whole pelvic floor, it works together, it's anterior and posterior, it's front and back work together to do a Kegel.
I do not know anybody who can isolate.
Okay.
Yeah.
So it's like if I'm doing Kegels, I'm hopefully working everything.
Yeah.
Okay. Oh, that's interesting to me. I'm going to have to do the test on myself. Do most people
Do it now.
Yeah, exactly.
Exactly.
We'll put it on YouTube. No, I would be the last person to do that because I'm like massively shy about stuff like that. Like I would not be able to.
Oh, same.
Even if you are too. Even if I came into your clinic, I'm sure I would be like, I'll figure this out and I'll let you know what happens.
And then I'll disappear.
Exactly. And then you'll never see me again. But tell me, how many is appropriate? Just so that like, I'm curious around like how many is therapeutic to actually make a difference?
If somebody needs strengthening.
Yeah.
Then what I usually have people work up to, and most people cannot do this on the first try if
Okay.
they haven't been already working on it, but I'd have people work up to a 5-second hold,
Okay.
relax fully for 5 seconds, do that 10 times.
Okay.
That's one set.
Okay.
You might try to get a couple sets of that throughout your day. But I want people to keep in mind before they start just, again, banging out Kegels.
Yeah.
It's not appropriate for everyone.
Okay, because you might do the opposite and make it too tight.
Exactly. And
Yeah.
if somebody's already experiencing pelvic pain, and again, one of the big giveaways with that is pain with penetration. So with that type of sexual activity, or difficulty with orgasm, or pain after sex, or just difficulty having a bowel movement, that's not the person I would just say, oh, just do some Kegels. That's probably going to make it worse.
Okay. Yeah, because then it's like, no wonder why it hurts. It's like a sore muscle, kind of, so to speak. Is that right? I mean, okay.
Oh, the pelvic floor is a set of muscles, which means we can treat it like a set of muscles.
Yeah. Okay. Do people ever end up taking like an anti-inflammatory or like stuff like that to relax the muscles or like a muscle relaxer?
Those things can be prescribed. Vaginal Valium is a thing.
Okay. Vaginal Valium.
Yeah, that you can get suppositories.
Okay.
Some doctors will prescribe those, and they can be really helpful in getting people to a place where they can actually then do some of the rehab because the pain is finally coming down.
Right. I think some of our listeners they don't necessarily, I don't hear people describe as much pain with sex, and maybe they're having it and not saying it, but they do describe like when you're just coming out, which a lot of our listeners are, and they're having a new kind of sex, that it's also like there's an anxiety around that and a difficulty maybe totally relaxing. So you're not having an orgasm, and then you're like, what's wrong with me? But it's like, it gets confusing, I guess, because it's like, are you getting more anxious because you can't?
Right.
And then
Well, and that's interesting because that, of course, brings a psychological aspect to this. And that, to me, is much more about where is your nervous system?
Yeah.
Is it in a stress response, or is it in what we call a parasympathetic state? So if we divide the autonomic portion of the nervous system, which is the part that we don't consciously control, like your heart rate and your
breathing.
Exactly. So that's the autonomics, but that autonomic system can be in stress response, also known as fight or flight, also known as sympathetic. Right, so the sympathetic state of the nervous system is not a very relational place. It's not really where great sex is happening.
Yeah.
And it's not quite as simple as just on-off with the autonomic nervous system. But for the most part, especially when you're beginning that build-up, that arousal state, and then what leads eventually to orgasm, we want to start in parasympathetic. And there is a very interesting sort of switching back and forth that happens from the parasympathetic relational state to the sympathetic response right when orgasm is happening, and then back to the parasympathetic. But if we're not able to access parasympathetic, which some people call rest and digest, but we should also call it rest and digest and have sex
Yeah.
or reproduce.
Right.
We're trying to alliterate. So we want to be able to get into parasympathetics. And I have to imagine, if I look back to the first time I had sex, was it a really like mind-blowing experience, or was I just like, well, did that?
Yeah.
Because it was super scary.
Yeah.
And so if you're back into that adolescent moment.
But you're so excited, but you're still like nervous.
So, sometimes there's a little bit of just getting used to a new partner and kind of getting into that. But it's often helpful to actually kind of honor where the nervous system is at. And I'm really, really anxious. So maybe I'm going to do some deep breathing, and maybe we're going to do some more intentional touch and connection before we just get to the stuff that I don't really know what I'm doing. And maybe that means we talked about it more in advance, or, however you get to that state of actually feeling safe, which is what's required.
And that is so
orgasm.
hard in a new situation. Like, it's not like something you can just walk in and be like, oh, okay, yeah, I'm chill.
Sure.
Or to even say to someone, I'm going to take some deep breaths.
Yeah.
Right? Like saying, I don't know. I think that is a good approach, though. Like, I think that's just it. A lot of people don't know what to say in that situation.
It's also
to say,
leads to
like,
mindfulness.
let me slow this down. Like, I need to kind of flow into this,
a little more. And then how does it, if you, let's say that they're a client of yours, they're coming in, they're doing the work, how does that translate to easier orgasms, better sex? Like, what is that bridge? What's happening that makes it that work, I guess?
It's a whole combination.
Okay.
But I think you used the word mindfulness, and to me, that's a huge piece of it.
Okay.
That person has to understand their body, and then they have to trust it.
Right.
And they have to listen to it. So I'm a big part of just guiding people.
Right.
And when I'm working with a patient, let's say we're working internally and they can't tell what I'm doing. I mean, you just don't have the same awareness of the pelvic floor by definition.
Right.
Especially the deep internal muscles. But I'm asking people as I'm palpating different areas, what does that feel like? What does that feel like? And do you think you are able to let those muscles melt or relax a little bit? So the more we're tuning into it, the more robust the connection is between the brain and the body. And then we start to actually have better access to that in other situations. So, of course, we're doing the physical work and the healing,
right.
And that's going to include whole body exercise in a lot of cases, because if somebody has like a really hunched shoulder posture, that's going to put pressure on the pelvic floor. So we have these objective things that we can change.
Yeah.
But then the process is about tuning in throughout all of that objective work.
Right.
So that
it's not
there
easy.
is that trust and that connection.
Yeah. So probably even,
first.
and to you too. Like, if they're coming in, like, what a vulnerable place to be in.
Yes.
You know?
I'm really grateful.
Yeah. Like, what kind of tips do you, like, because both Allie and I are having this kind of like immature reaction to like this conversation as it is. Like, what do you recommend for people to like kind of get over this embarrassment, I guess, for lack of a better word, of like approaching the subject and asking these questions that are coming up?
Well, my approach is that I ask a lot of questions because I think people often, they don't know that what they're experiencing is completely normal. It's very common. I have yet in this, I've been doing the pelvic floor treatment and rehab for, like I said, about 8 years. I'm not hearing new stuff anymore.
Really?
Right? Like, people come in and they're like, I can't believe this. It's so embarrassing. And I'm just like, it's not, like, I hear this every day. You know? So that is helpful, normalizing, which is why I do wish people would talk more. As most of the time, the thing you think you're experiencing that isolates you is actually, there's somebody probably sitting right next to you who's having a similar experience. But I'm also asking all the awkward questions for people so they aren't being asked to volunteer that information.
It's like, am I a total, they don't have to feel, if you're asking, obviously it's a thing that other people have.
Exactly. And one of the questions, I often get the response of, nobody's ever asked me that before. When I ask people, do you have orgasms? Is that important to you that you have an orgasm? What does sex look like for you? Like,
does anyone say, no, it's not important?
Nobody said that.
Okay.
No. But I'm sure there's somebody out there, and okay.
Yeah.
You know? I mean, my job is to accept the patient, whatever they present to me, I just believe them and I trust them.
Yeah.
And that is really helpful.
Yeah. I think for sure
you know?
in anything, it's like you are very disarming. Like I could see where you'd be good at that because you are disarming. Like I could see where it's not hard to tell you. People probably do sit down and just then they start telling you lots of things.
They unload. They start telling you their deepest secrets. What are some like symptoms maybe that are kind of like overlooked, like that someone might be like, oh, that's not that big of a deal, and it really could kind of maybe grow to be a bigger deal?
I do think the peeing, you know, with the cough or the laugh or the sneeze or jumping, that I think a lot of people are told it's normal. So to me, it's definitely not normal. It's something that we should be at least taking a peek at.
Right.
And again, if somebody's having leakage, it is often a strength issue, which is one of the most, we have such access to strengthening. Like we know how to do that. We know what Kegels are. So if I can train somebody not only how to properly do a Kegel, but then when to do those Kegels. Yeah. Right. It's the whole, and this is, I did not make this phrase up. This is well known in the pelvic community, but squeeze before you sneeze. Right. If you're leaking when you sneeze, maybe just try doing a Kegel when you're about to sneeze. I bet you half of the people who are doing that will no longer have that problem. Right?
Okay, and then they squeeze, but then over time they won't have to squeeze because the muscle will be stronger.
Because we will behaviorally train that muscle that's just what you do. If a sneeze is coming, the muscles go on.
Okay.
Right? We're potty training.
Exactly.
I mean, potty training is a slightly different mechanism, but
how would you say after people have a baby, they're like twice as likely to have, like how common is it after childbirth?
I do not have an exact number for you. I'm not going to make one up, but it definitely...
It seems like in your
definitely goes up significantly, and it's because again that is a taxing experience for the pelvic floor, but with a little bit of rehab, it can all come back.
When do you know if it's like beyond? Like, is there ever they come in and they're doing it and it's just not getting better?
Yeah, there are definitely times that it's beyond the scope of just conservative rehab, which is what PT is going to be, and those patients. I mean, if somebody has a really severe prolapse, which is when the pelvic organs are actually displacing and dropping sometimes like visibly out of a vagina.
Oh my God.
Yeah.
Is that painful? Like how?
It's not necessarily painful. Often it's described as a really profound like pressure sensation.
Okay.
Or again, you can like see it. Right?
Yeah.
So if that is severe enough, that is a surgical situation.
And if you can see it, how do they have sex at all? Like if it's in the way almost.
A lot of people don't.
Stop.
Yeah, I mean, there is definitely some shame associated with that. Now, pelvic organ prolapse is going to worsen when somebody's in a gravity-resisted position, meaning you're upright, gravity's pulling the organs down.
Right.
So if we're talking about sex, if that person is horizontal, gravity's
not going to be.
You know, pelvic organ prolapse is almost always better in the morning, worse in the evening.
Muscles are
because
tired.
Gravity has been working on those organs all day.
Okay.
And then the muscles could also be tired, so they're not holding things in as much.
Right.
But if a person lays back down and they can actually just nudge things back where they belong, you could have sex.
Wow. Okay. I've never heard that before. Have you?
We're just tucking things back in.
Give me a minute. Yeah.
That's, and there's also
that doesn't sound
there's a device called a pessary.
Correct.
Okay.
Not sure if y'all have heard of those, but I think of a pessary as an internal scaffolding, like that we just pop in.
Okay.
So there are these they come in a bunch of different shapes. There's like a donut-shaped one, there's a square one, but basically it is reinforcing the walls of the vagina. So it goes in and it holds things up. So people will wear them for months. Some
and then
people will take them out themselves and,
Wait, wear them to bed or where is it so it's not coming in and out. It's like you just put it in and it's there for months. No one can see it.
I have patients who like being in control and being able to take theirs out and place it back in when they're ready. And some people don't want to do that. Some people are kind of yucked out by it and it just sits and they go to their gynecologist to have it, checked every 3 months or so. They're not hard to place though. So for most people, I recommend if you're going to use a pessary, you want to just be able to place it yourself. And you could take it out for sex, although sometimes you can leave it in for sex. Like, it just depends on the pessary.
I've never heard that word in my whole life.
Never.
Like, it just shows, though, too, like how little people talk about this.
Yeah, and we have solutions.
Yeah,
so
it's
let's talk about it.
Yeah, let's do. Because I think about like friends of mine who have said like it hurts to have sex, or it's, you know, whatever the thing, like they pee when they cough, or they, and it's always like you just accept it as like this is what it is to be 40, or this is what it is.
It is pretty
50.
wild. People just like write off like, oh well, I just won't do that anymore.
Yeah.
I won't have sex. I won't sneeze.
Right. Is there a conversation? I watched this documentary with who's Goop, the girl who started
Gwyneth
Paltrow.
Gwyneth Paltrow.
Yeah, the sex one. Did you see it?
I did.
Okay, it's been a long time,
Yeah.
but she was with like a sex therapist, and they were showing like how people have orgasms, or how, and like it was fascinating to me that first of all how little knowledge I had, number one, but also other people. Like even like there is so much involved, and everybody is so different. Like they did a thing where they showed all these different vaginas, and they look totally it's like shocking to me that like
I mean it's the same thing as that Naked Attraction show on HBO Max. Have you watched that at all?
No.
Like they're showing close-ups of like male and female
and they're so
genitalia,
different.
and it is like it's so different, and I'm like, I mean I guess I knew that, but I didn't know that, you know, and it's just like it made me feel better about things, you know, like everybody's kind of like
some labia
different.
Look like
it's
this, other labia look like that. I mean, I've seen so many vaginas at this point, and I never thought that would be a thing I'd say to anyone.
Yeah, I've seen so many vaginas.
But yeah, you know, each one is its own beautiful individual flower.
And each one probably has a different process too. It looks different, so the muscles are a little different. So even though they're the same, it's like it might be a different process for one person to get off and another one for someone else.
Oh yeah,
there's like so much involved to that, and to me, I can see where that's frustrating.
Might be really sort of tucked away, and some of them are like, "Hello, here I am."
Yeah,
and all the other pieces that you can't actually just look at visually. But
is it ever like you get in there and you're like, no wonder why you can't have an orgasm? Like this is like you're going to have to work a little harder. This is tucked in,
you know. Or I want to say, thankfully, that's not been
the case.
Yeah, like there's always a way.
Yeah, sure.
And the
you're gonna have to work harder.
You might have to work a little harder.
I mean, I'm assuming everybody in this conversation has a clitoris. They are much bigger than we realize, right? Like there's the little part on the outside. So if you're relying on that, that might make it harder to have an orgasm. But the clitoris has legs that actually are underneath the labia, and they go out to both sides, kind of underneath the pubic arms, in a sense.
I'm picturing like a wishbone.
Yes.
Okay.
That's a great way to look at it. That's very much what it looks like. And the clitoris also goes back. I mean, it's the same tissue as a penis. It's a slightly different placement, and the size actually isn't as different as we'd like to think it is, or at least maybe our male counterparts want us to think it is. But it's a big thing, and there's lots of points of access to it. So once we understand how to operate the machinery, like there's just lots of hope for people.
The sky's the limit. This may be more of a urology question, but I had this friend who, whenever we would hang out, she would go, like, if we're at a restaurant, she would go to pee, and she would be like, give me a minute, because my doctor told me to wait for the after pee. Like, I take a minute, and that always stuck with me, because I realize, like, when I go pee, like, there is, if I try, there's more pee always that isn't just like a normal thing.
I don't want to violate your privacy.
No, violate my
now.
privacy. I don't care. So she was telling me this, and so I've started doing that.
Okay, so when I hear that, I think one of two things.
Okay, tell me.
I think one, maybe a minor prolapse.
Okay, could be 3 babies.
Exactly.
Yeah.
And if you had vaginal deliveries, there was pushing and there was bearing down, which makes the bladder more prone to displacement.
Right.
Now, if you're not feeling that pressure sensation all the time, this is probably not like a grade 3, 4, like really severe prolapse, but it could be enough that the bladder, when it moves slightly out of position, it bends the neck of the bladder.
Yeah.
So there's like this little reservoir of urine that just sits there. So when you pee, it's like most of it comes out, and then you wait a second. The weight of the urine is off the bladder, so it lifts up, and then that little reservoir, the rest can come out.
Okay, and like in the past, I might have
to me a sign that we need some pelvic floor
Okay, well, I guess I'll be coming in.
Yeah, and then and also just for you, if you're not having painful sex, try those Kegels. Like, see how that helps, because that may be your solution.
Right.
But also happy to help you.
But did so do you think because like I always wonder, does she mean she's just passively waiting, not necessarily like pushing the rest of it out? It's like she's
you don't
just
want to push.
You don't want to push.
That is not ideal.
Okay.
The question is, was it also difficult to start the flow of urine? Right?
For me,
because
no.
If it's difficult to start, then we know we have a high tone pelvic floor, meaning we're holding more tension. And sometimes it's, it'll come out just because you have to pee so badly, but then the tone kicks in when there's not as much pressure behind the urine coming out. And that's when, maybe we wait a moment, then we can relax again and more pee can come out.
Okay.
So it could be tone, it could be prolapse.
Right.
It could be something else that I'm not thinking of. I mean, there's a lot of possibilities.
So many different things.
But
that's really interesting. Do you have any issues you want to bring to the table?
I don't, but I was going to ask about resources. If there's do you have an Instagram page where you're posting about this, or have any people that you follow that have good stuff to say?
I mean, you can find me on Instagram, and I may or may not get back to you because I'm just the worst. But oh my God, what's my handle?
Tell us your practice
it's
too.
At Kara Strauss _DPT.
Okay.
But
at Kara Strauss
_DPT.
Okay.
Yeah, as in Doctor of Physical Therapy.
Yeah.
But my practice is called Superhuman Therapy. I'm located in Grant Park in Atlanta. And superhumantherapy.com if you want to come in and see myself, or I actually work with another really wonderful pelvic floor therapist. But yeah, we're there to, if you just have questions, you can submit an email, and I'm happy to just help people with easy questions that you don't have to come in and have a whole visit. If it's something simple, I'm not going to withhold that information.
I love this.
But yeah, come and find me if you want to.
Yeah.
There's
Superhuman
also
Therapy.
Lots of other wonderful pelvic floor PTs around Atlanta and around the whole country. I think it's pelvicrehab.com.
Okay.
Is the resource where a lot of pelvic floor PTs register. So if you're like, well, I'm not in Atlanta, what do I do? I think it's pelvicrehab.com. And there's a whole database of pelvic PTs who are well trained.
Let me ask one more quick question. Why do you think that people do have these emotional, do you think it's just relief, or do you think there is something really physically happening that creates this emotional release? It's kind of like some people go to get a massage and they're like, it makes me have this moment. Why is it? Is it real physical, or is it more just emotional? Like, oh my God, this is working. I'm so happy.
It's both.
Okay.
It's definitely both. And this takes us back to the nervous system. And whether it's a sexual dysfunction that a person is having, or they're in pain, or just, anything that goes on with the pelvic floor feels pretty pivotal to just feeling like a normal human.
Happiness.
Yeah. Like, oh my goodness, I can go to the bathroom when I want to.
Yeah.
That's a huge foundational big deal.
For sure.
And so is pooping when you want to poop.
Yeah.
And so is having good sex if that's something you want to do. So it feels really like baseline, this is being a human.
Mm-hmm.
And anytime we have dysfunction in one of those areas, that's really disruptive. And then, of course, if you add pain to that, and what pain does to our psychological state, our just our whole emotional, physical connection, it's this really complex interaction that, when we start to get that kind of function back, it is kind of life-changing.
Yeah, I could totally see that.
Yeah.
That's
and
amazing.
That's also true for anybody who's, for a person who's been having chronic headaches for months or years. If we see that pain go away, you finally get to see the real person there.
Right.
As opposed to the person who was in the stress response because they were in pain. They couldn't be themselves. Can you imagine just hurting all the time?
No.
And what that does to how a person is interacting with the world.
They do say that, like, they do say removing a painful stimuli is more like people value that more than even having a positive stimulation. So it's like, if you take away my pain, that's a bigger help to me than even giving me something amazing. So it is, I can see where that's...
Doesn't that just transition us right over to grief?
I know, right? There you go. Oh my gosh, yeah. So, well, I guess we should just do it then.
Okay, let's dive in.
Yeah. Well, first of all, how gratifying your work must be to be able to give that to people. So, Superhuman Therapy, Dr. Kara Strauss in Atlanta.
That's me.
Okay. But we wanted to just touch on grief because lots of our listeners are going through that, and we all personally have been through some. So we thought that might be another cool little segment of this episode. So do you want to kick it off, Melissa?
Do I want to kick it off?
Yeah. It's maybe the freshest in your mind.
Yeah, I won't go into details on my current situation, but I'm going through it, and we'll put it that way. But what I've been realizing personally is like that so often when we're going through a breakup, that we're not necessarily like we're in mourning, we're grieving the relationship, but you're grieving it in like multiple parts. You're grieving the human that you're losing, that you're no longer they're not going to be part of your life anymore, but that you're also grieving the life that you had envisioned with them. And that part to me almost feels like more difficult to wrap my head around.
Yeah, like giving up the dream.
Giving up the dream and like almost like feeling like the setback, I guess. The air's been let out of your balloon a little bit of like what I thought was happening is not happening. And that means that like when I do finally find my person, it's just like that much far off in the distance.
Okay. Yeah. Like does
that make sense?
Yeah. Like you thought you were at the end of the marathon and now you're back at mile 3.
Right. Yeah. Like like I was playing a board game and I got sent back to the start and I got to do it all over again. You know, like it's just deflating.
I can see that. If you say more though about like what in your mind, what was the dream? Like say more.
I mean, the dream scenario for me has always been that I'm going to, meet somebody and they're going to eventually want to move in with me. And we're going to like kind of tag team this kid situation. Of course, like my kids are pretty covered. Like I don't need like a ton of help in that area, but be able to travel together and have more of like a family atmosphere than what it is just with the 3 of us right now. But I've also started to like kind of shift my perspective on that. Like, what does my life really look like? And is that like really an ideal situation to have someone come move into my house? What do my kids want? Are my kids perfectly happy with it being the 3 of us? And kind of just that ebb and flow of like, what's to be expected in life and kind of like being able to grieve it and then cope with it.
Right. Yeah, 2 different things. Like you're allowed to be sad about it. And then at what point is it like, I've got to package it up and kind of move on or find other things that are exciting. And kind of like that therapist said to you, you're grieving what was inside of you. Like it's you that brought that energy to the relationship.
Exactly. And I think that's the other thing is like, we so often put it on this person, and not to say that the people that I have dated aren't lovely, amazing people. They all are
for sure.
But it's also like what I bring to the table and that I have to like, I can be fun with anyone, you know, I can be a really good person to be in a relationship with. I'm good at, listening and coming up with stuff to do. And I love to go travel and try new things and be adventurous. To a degree.
I would agree with all those things and more about you. You're amazing.
Oh.
Well, I think so. Yeah. But I think it is like a process and you've sort of I've watched you kind of accept sitting in it and not trying to like mask it, which I think
Right. And I think that's the biggest thing this go around is that I'm not trying to mask it. I am sitting in it. I am uncovering parts of me that feel triggered right now. I am grieving. I'm not relying on any substances to like make me feel better. I'm sitting in it and dealing with the lack of sleep and the tears and all that stuff.
Right. And sometimes that's just what you have to do temporarily. What's your experience with grief, Kara?
Yeah.
Or do you prefer Dr. Strauss?
Oh, definitely Dr. Strauss. That's what my parents have to call me now.
Good. I'm going to call you Dr. Strauss from here on out.
I mean, if I had a doctorate, 100%,
it actually does sound
like,
really cool. You should really do that.
I'll think about it.
Okay.
But yeah, I mean, my current experience with grief is that I'm very much in it.
Yeah.
You know, a 5-year relationship is over, and, you know, will I have a relationship with that person going forward? Well, certainly not a romantic one, but maybe there's a potential for a friendship one day. And,
right.
you know, it's this, I think just like what Melissa was saying, I went from feeling like I knew where my life was going to go to now a very obvious, ambiguous state.
Yeah.
And that's scary.
I don't like ambiguity. Like that's I have to have a plan.
It's really stressful.
It's very stressful to have limbo.
But I do think there's a little bit of, were we really clear on where things were going? Like maybe we thought because, okay, this is the person I think is my person.
Right.
And, you know, I know what my life with them looks like. You know, we have our house together. It's decorated this way. But truly nothing is actually permanent.
Yeah.
And that's probably a good thing.
Oof. That's hard for people like me to hear. Like, I don't like the idea of like, you just like have a series of long relationships. And then like, to me, there's something so lovely and beautiful about finding someone. And then you're like, have all these memories. And then you're like 85 and together. But I think sometimes that there's like a new reality for people that's not, first of all, it's not everybody's dream. Maybe that's just my dream. But it's also...
I can't say it's everybody's dream.
Yeah.
I'm sure it's not, but it's definitely what I'm hoping for.
Yeah,
eventually.
there's like a safety to that.
And I think safety is the word I was thinking as well. Like there's just this sense that I don't know what's coming, but at least I know who I'm going to go through it with.
Yeah, and then my problems are half with someone you can depend on.
Except they weren't.
Yeah, right.
So, you know, and I don't want to get into trash talking because that's not the place I want to be in. But what I realized is with the person who wasn't the right person, the problems were more than doubled.
Yeah,
because
that's so interesting, right?
It not actually being right for either of us.
Yeah, and so it's like not taking away from your, like we talk about like in our relationship, like pulling the wagon. And sometimes I'm going to have to pull it. Sometimes you're going to have to pull it. Sometimes we're both pulling it. Mm-hmm. But in life, it's like there's this ebb and flow and it's never 50-50, but I trust that if I can't pull it, you got it. And I think when you find out that that's not the case, you're right. It becomes like really burdensome.
Oh my goodness. And I was doing the emotional labor for everybody in the house. And it turns out also the cleaning.
Oh man.
And the thing that is really kind of a delight right now, having lived with this person for 3 years and not even realizing that I actually don't really make a mess that much.
Oh my God. Yeah.
So I mean, it's more than a silver lining. I just don't have to spend nearly the amount of time cleaning that I used to.
Right.
It is whatever, like the reverse of exponential. It was just such a dramatic drop off in the cleaning that I'm doing in my house.
That was a gift.
That should have been, it should have been.
That's hilarious.
Yeah, that is. It's like, there's your silver lining.
like that's what
Yeah.
you're noticing.
I know.
The bed making is easy. And I'm like, well, okay, at least we have that.
Yeah.
And I could accept that.
For sure.
For the right person. But since we've determined mutually that we were not each other's people, what a treat.
Right. Say more like Melissa did about what you did envision. Like what did you think, if you could paint the picture of exactly what you wanted?
Yeah.
Like I know Melissa has told me pretty clearly through the years, like exactly what she thought. What would you have said?
Like specific to
like how did you see your life? Like how did you see it unfolding with this person or with any person that you found? What did you picture happening? Like what's your...
I'm an independent independent person. God, that sounds so cliche.
Yeah.
But I am a pretty independent person. I'm a pretty confident person, and I know what I like and what I'm into, and I have a lot of hobbies, and I have 2 jobs, and I have a lot going on, and I want to be with a person who actually sees that and respects it.
Right.
And certainly not to say that my ex didn't respect it. But knowing that I have these, I love science, I love learning, I love movement. I mean, it all fits as a PT, that these are the things I want to do with my time. And my hope is that my partner will share some of that with me.
Right.
But certainly we don't need to be everything to each other. And I can just as easily go out with my friends one night and not have that be a problem for anyone, but know that we have this deep connection that we're always coming home to.
Yeah, I think that's well put. Yeah, I think that...
that sounds a lot more eloquent than what I said.
No, I mean... And I think you learn as you go through relationships, it changes a little bit, like what you need or what you want. I mean, I think I told you earlier, like my needs through the years in the relationship I'm in have shifted to where like I really value safety and stability and predictability. I'm pretty boring, really. Like I love to read. I want to be home pretty early. I like to wake up early. Like I'm not I like predictability and safety. Like I just know that about myself.
Well, and in that safety and that stability, there's a sense that I could mess up a little bit.
Yeah.
And you know me well enough.
Right.
And you respect me enough to know that I'm still the good person.
You have enough in the emotional bank.
That, yes.
I can take a withdrawal every now and again.
That goodwill is just, it's there, and it's just that nice little nest egg that
right.
when I'm having a bad day, you understand that that's not really who I am.
I think that's hard. It's not simple to find. That is security. And I think it's like you date people for long periods. And like we've talked about, I mean, our therapist said that you disregard the first 2 years with anyone because those are,
this is news to me. I always heard you shouldn't make any permanent decisions in the first year. So know someone for 4 seasons. That's what I always heard. And that's kind of what I lived by.
She said,
and then you're telling me today,
months.
2 years.
She said 18 to 24 months.
I'm doing the math on when we moved in.
Yeah, she's like that. Okay. Disregard anything because I kept bringing up things, and she's like, anything that happened in the first 18 to 24 months, throw it away.
Where does a pandemic fall into that?
I know because that's the problem. You were like, really? I know.
Right. Pandemic timing. 100% plays into that.
And relationships are supposed to morph and change. Like they're not supposed to just look the same. So it's also like when you find your person, you evolve together, hopefully, and like.
But it's also kind of like when the work comes in, like things, you're right. Like the first 2 years, it's pretty easy breezy. Yeah. You're in that honeymoon phase. Yeah. But that's like when the work comes in. And when you reach that point and someone's like, like this got a little too serious. Like this feels a little too hard. And they just bail. Mm-hmm. Like that's 2 years is a lot of time to invest in someone to then turn around and find out like they're actually not wanting the same things that you want.
And maybe they thought they were. Like sometimes I think people go into it, you're in that honeymoon phase, it's the drug, you're taking the hits, and you're feeling high. And so it's like, I can do it.
The high wears off.
Off. And then it's like, you know what? I really don't want to do this with you anymore. Mm-hmm. And I don't think it means you're wrong or I'm wrong. Right. It just sort of means like I've grown into a different space and this doesn't quite match where I am right now.
I'm trying to get good with this idea though that just because it ended doesn't mean it was bad.
Never. Right.
Like I had a beautiful experience.
That's it.
With my partner who is now my ex-partner. I still have love for him. Did I just come out? Anyway.
That's okay.
Came out
as straight.
Whatever I am. But I still and always will have love for him, and I want good things for him. I don't see us being able to have the life that we want together.
Yeah.
But I have, right now I'm really in the grieving process, and there is anger and there is sadness, but I know eventually I'll look back with fondness.
What are your tools? Like we talk a lot about like tools in the toolbox that you like go to. Mine's running. Mm-hmm. I like reading. I work a lot. Like Melissa has her tools that she like reaches for in these tough times. What do you do?
So there's the tools for when the feelings are too big. And I think a lot of the things you just mentioned, so being active, diving into things that really do make me feel like I'm in a flow state, or just spark my intellectual curiosity, listening to music. But also, I'm really big on sitting with discomfort and exposure therapy, essentially. So, I was telling you earlier, Allie, I have a painting that, my ex is an artist, and I have a painting he did, and I'm leaving it on the wall because I love it. It's beautiful. He's very talented, and I'm not taking it down. It makes me happy, and I know it will make me even happier when the grief is really done.
Yeah.
But I want to get ready right now for that moment that I run into him, and maybe he's with a new partner.
Yeah.
Like, it's going to happen.
I know.
I can't have that break me.
Right. And I think that is true.
I want to be ready for all those feelings, so I'm going to practice having them right now.
Like a picture in your mind, like this is going to happen. Yeah.
And that, it hurts.
Yeah.
It really hurts. It's beyond uncomfortable. It is painful.
Oh my God. I would be like so jealous.
Yeah. It won't feel good. I won't like it.
No.
But I'm going to be kind to myself. And I'm going to, in those moments of discomfort, like I get eye to eye with myself in the mirror, and I cry, and I
rub your own back. Yeah.
My little inner child, and say, like, what you're feeling is absolutely okay. And remember, you chose this.
Right.
You actually want this.
Right.
Like, this is right. It just feels hard for now.
Yeah. So. How long do you anticipate? Like, I wonder how long they would say that you should expect to feel. Like, everyone's different, but I know that sometimes people say, like, however long you are in something, expect half the time you're going to be still. Yeah. And I
don't know.
Yeah.
I don't know how to gauge that. I also think I was grieving my relationship ending a year before it ended.
Yeah.
So I think I've done a fair amount of that work. It still got way harder when the actual breakup officially happened, but I do think that I've been in that work for a while.
Right.
I'm definitely not in a hurry to date right now.
No.
And I don't know. I'm just going to trust my body to tell me
when the time
comes.
I'm
having the feelings I'm feeling. There will be a moment where my body says, your heart might be ready to open up again.
Right. And maybe it takes the right person. I mean, it might be that you're out and some random serendipitous thing happens.
That'd be great.
Yeah. Right.
That'd be just fine. Yeah.
How about you? What are your tools right now, Melissa?
I mean, like you said, just kind of sitting in it. Like I just took my kids up to North Carolina, just a quick little trip. That was kind of part of it, getting this spontaneous trip and being like, you know what, they want to see snow. Like, let's find a way to go see snow and have fun. And for me to act like a kid a little bit. And we went snow tubing, and I was right there with them going down the hill and having fun. But also, like, on the drive, I started to listen to like a couple like distracting podcasts, and then I was like, you know what, I'm just going to kind of sit in my thoughts. And I did. I mean, it was surprising how long I was able to do that. Like, I mean, it like close to 2 hours.
Wow.
Of just
I don't think
like
I could
thinking.
do that. I honestly don't.
And I've been doing that a lot too with, I started running again.
Oh, nice.
Not far, just like enough to get like my blood flowing,
You're alive.
And running without anything, like no headphones or anything, no music.
Wow.
And just kind of like letting myself think. And I think that's the biggest thing, but I also am like, God, how long does this take? Like,
what about
how long is it going to be?
Sitting in it that you both talk about? Like, for me at night is when I'm like, I start my head, like I do yoga nidras to fall asleep so that I'm like not in my head. Like, what do you do, both of you, to go to get sleep so that your mind isn't just like running through the worst case scenarios?
I mean, there have been nights that I've had no trouble and I'm sleeping like a baby.
Yeah.
And then there have been a couple nights where I got into bed and I used to share that bed.
Yeah,
with this
that's what I
partner,
mean. Right.
And I'm lying there.
Lonely.
And I just fucking cried out.
Yeah.
Man.
Yeah.
Like, I just sob and I do the same. I didn't get out of the bed and go over to the mirror, but I imagined,
Yeah.
and I just let myself have whatever moments that I need to have. I don't know. I think it is just about letting it be, letting the feelings flow, not trying to resist them.
Yeah. And sometimes that does look like crying hard.
Yeah.
Yeah. That's interesting. How about you, Melissa?
What was the question?
Sleeping pills? Sleeping pills over there?
How do I sleep? That's a great question. Please tell me. Because I don't sleep much. I mean, that's also combined with like, I just change work schedules and it's kind of torturous. But I do try to do like, I tend to fall asleep to like watching like my comfort shows, like Friends and stuff like that. But I have been doing some of the nidras. I've been doing just like falling asleep to green noise on YouTube and just, I don't know, just trying to like relax. But sleep is really hard right now. That's kind of when the anxiety starts to come up.
Yeah,
for sure.
It's definitely true for me. It's something about that nighttime that's like, I've even the last couple nights gotten up at like, I'm talking 2 a.m. and just opened up my laptop and started working. And then I'm like, oh shit, it's 5 a.m. I don't have a traditional job where I have to like get up and be somewhere. So I am like, if I just sleep, I'll sleep. But even then I never can sleep past 6:30 or 7. So it's like, I'm up all night and then trying to like do the day. But if I'm laying there and I can't sleep, it's so frustrating for me that I can't.
I get sleep anxiety. Does that happen to you?
Sleep anxiety,
like,
totally.
Yeah.
Yeah. Where I'm
it's like I'm anxious about the fact that I cannot sleep. And then I'm like, I'm going to be screwed the rest of the day. Like,
right.
I'm going to be tired. And there's like, it's so hard to like snap your brain out of that anxiety mode.
I know.
Like bring it down.
And then you know that you're going to be more emotional about the problem the next day because you're exhausted. It's like sleep is so imperative. It's everything.
So incredibly important.
Yeah.
For so many reasons. I used to be up with my thoughts more. I'm very grateful to say I'm a really good sleeper.
Yeah.
If I want to go to sleep, like I am going to.
Even in this stressful time for you, you can do it.
I have had. It's kept me up for 10 minutes longer than usual.
10 minutes.
Yeah. And that feels like a smug asshole thing to point out right now.
Well,
so
I'm sure you
apologize.
have other things. Yeah.
Yeah. Oh, I definitely have lots of things that I struggle with.
But sleep's not the one.
Yeah. And I don't know what I'm doing. Maybe I'm just so exhausted.
Yeah. From dealing with it all day.
I think that's probably it. Like,
because I work.
I have a friend who has 3 kids and works full time. Like she's busy and she is always like, my head hits the pillow and I'm out. And I'm
but
like,
I have all those things, and I'm not. My head at night, I'm like wired. I'm like, why? What is wrong with me?
When I used to stay up like with my thoughts, though, I do think the thing that helped me was having a journal by the bed that I could write it down.
Everyone says that to me, and I don't know why I haven't done it.
Out of my head, and just onto paper. I can let that thought go now because I know I'll remember it and I'll come back to it. If it was that important,
I do that too, but I do it in my phone. Right. I probably shouldn't be picking up my phone, but my handwriting's terrible, so I have to type stuff.
Well, yeah, I mean,
but that part does help. If there is something like running in my head, I'll kind of journal it out, and that kind of helps subside those anxious feelings.
Writing is really, really therapeutic.
Yeah.
I mean, it doesn't have to be going to someone or something. You can just literally
stream of consciousness.
I wrote down what I was feeling, or I wrote a letter to the person that I was ruminating on, or whatever it might be. I do find that's super helpful.
Right. I know in therapy, she would have me sometimes do just like stream of consciousness, like just verbalizing my stream of consciousness. Mm-hmm. And it was like interesting because it does sort of take it out of you and put it out in the world, and then it's like somehow I felt better. I felt weird.
It is weird. It is very weird how good it can make you feel, especially like you're saying, Kara, like the act of writing a letter that you know you're not going to send, but you are writing it to that person and kind of like venting all the like frustration, anger, sadness, all this stuff that you really can't say to them.
Yeah. Well, and I'm a very confrontational person. I do tend to say exactly, like maybe to a fault, let's be honest. But I've gotten into the practice now when I write those letters of asking myself, like, what would I actually be hoping to achieve if I were to hit send?
Right.
And that has been the thing that has kept me from hitting send a lot of times when I am really glad that I didn't hit send.
Because why? Because you're honest with yourself of like, this is only vindicating me in some way that's not really getting me peace. It's not bringing me.
I want this person to know how wrong they've been, and I want them to feel whatever feeling I think they should be feeling. It is all about justice. Yeah. That's not my business. I need to be reminded of that often, though.
I know. You know what? I think I have that. I'm reading this book, Codependent No More, and she's like, I seek justice. I cannot stand it if somebody's like getting away with something in my mind.
Yeah, my therapist totally had me read that book.
Yes.
Too. It was so helpful.
It is.
Wait, what's the book?
It's called Codependent No More. It's a little bit, by the end, it's getting too much talking about being with someone with alcoholism, and I don't have that issue. But I do have the issue of like, my mood is very heavily affected by who I'm spending time with, what they're going through, or that this plight for justice. Like, I can't stand it.
I
if
feel
you don't
that too,
apologize
man.
to
It's
me
like you want,
for that
you
wrong
want
thing,
an apology.
I need an
you
apology.
Want ownership of what the mistakes were. Like,
do you know that about me?
I want all of that.
Yeah, you do
I
too.
want it too.
Yeah, you do. But you're chill. You're more chill than me. Sometimes Melissa will have something going on. This has happened a couple of years ago where I'm losing my fucking mind for her. I want justice. I'm I can't stand this. We are getting justice.
I was like, where's the baseball bat?
I'm literally like, today you're getting justice. And I can't stand it. And she's like, well, you know, I mean, it's okay. There's a history here. I'm like, no.
Like I try to put myself in other people's shoes a lot.
Oh, I don't.
Like I really do. But at the same time, I do want people to really grasp and understand and apologize and like understand what they did and like the place it's put you in.
Right.
And that, like, I keep repeating this to myself a lot, like lately, is that just because someone's intention wasn't to hurt you, it doesn't mean it didn't hurt you.
That's it.
Right.
You know, like that doesn't mean it wasn't your experience. And I think so often people just overlook the hurt that they caused because it was an intentional hurt. Yeah. And yes, like I get that. I've done that. You know, I've not intentionally hurt someone. That doesn't mean that wasn't the other person's experience. Like, and just acknowledging that you hurt someone, I think goes like so long with that person.
I would agree.
Like validating their experience and their hurt.
I would totally agree.
So I, you play that game, like if you could have a superpower, what would your superpower be? And I don't know, do you guys have like, oh, I wish I could fly or like see through clothing or whatever? I
know what you mean, but I haven't thought about it.
Superpower that I always wished for, it's the most codependent thing ever. And now that I'm aware of codependency, I'm like, oh, that's embarrassing.
Yeah.
But I always wanted to be able to make people see the consequences of their actions.
See the error of their ways.
Oh my God.
Like, who wants to hang out with that superhero? That they
you
just
sound like a lot of fun.
Like, guilty around all the time.
I don't think they'd be making
But
any
that
Marvel
is, like,
movies
I'm
around
like
that.
Accountability woman. Like, that's what I wanted. It's so sad. So anyway, I realize now anybody I said that to was probably like, well, that's a codependent if I ever saw one. But it took me many years to realize.
I don't know if other people even recognize it, though. Like, to me, it's like I'm doing a service for the world.
Yes. And that's the thing.
Like, that's the problem.
Sometimes you are. Sometimes bringing things to light is really important.
Yeah.
But I think there's a point where you're trying to control how other people feel.
I am.
And that is less healthy.
It's totally. I recognize it now. Is what I'm learning as well. Yeah. Like, I feel like I am the worst at that. I want to control the outcome as well. So not only am I going to control how you're feeling, but then I'm going to control what happens next. Mm-hmm. And it's just... It's terrible.
I think
it's too much.
Really frustrating too when someone treats you the way that you would never treat them. Like, or just how you wouldn't act in the world. Like right now, I'm dealing with a renter that's not paid their rent, and I'm having to like deal with all this stuff going with that. And I'm just like, I have always paid my rent, and like the fact that this person just is like, nah, like not even communicating with me about it, nothing. Is like so frustrating, like
the injustice of it all.
Let's go handle that.
Like, trust me, I want to.
I mean,
it's true.
Find them.
It's also just beyond even just the controlling and it is though about like, I can't, like if you come home from work and you're like not in a good mood, I would think to myself, like, what happened? Is it me? Like, what happened? Are you annoyed to be here? When really 90% of the time, it has nothing to do with me.
Yeah.
And it's just like, why do I do that? I don't know why. I want to give zero fucks and just be out in the world.
I wish I could.
I think that's a good
I
place
try
to
so
end.
hard to give 0 fucks.
I know, 0 fucks. Maybe we need to do an episode on how to give 0 fucks.
Yes.
Like, how do you, like, there's got to be like a
how to
list of
not
things. And
care.
ask yourself these questions. And if it's, whatever the answers are, don't care. Like my mom used to always say, does this going to matter in 3 days, 3 weeks, 3 months? And like, if not, like, who gives a shit? Let it go.
I'm excited for this episode.
There's a lot of
Yeah,
things that
let's
will
do
matter.
it. Huh?
I can help you with it.
Yeah, there are a lot of things that will matter in the 3 years.
I know,
Still,
it's true.
you know?
But a lot of
Like,
the things
that's
we worry
hard.
about won't matter.
Yeah,
But I'm with you. I'm totally with you. I think it's a good place to wrap up.
I think so.
Yeah. Well, Dr. Strauss, it's a
Yes.
pleasure having you here. Let's repeat the name of your practice one more time.
Superhuman therapy.
Superhuman therapy. So look it up. It's in Atlanta. Pelvic floor dysfunction, but really any kind of physical therapy. Excellent.
All your standard ortho problems. Oh,
Very cool. All right, guys.
Awesome. Thank you, Kara.
thank you.
Bye-bye.
Want to support the Lesbian Chronicles podcast? Rate us and write a review on Apple Podcasts or Spotify.
We love listener feedback. If you'd like to share your story, email us at melissaandallie@gmail.com. That's Melissa, MELISA, and Allie, ALLI, @gmail.com. Or follow us on Instagram at Lesbian Chronicles.